Hello, welcome to today's University-Based Child and Family Policy Consortium webinar. My name is Patricia Barton and I'm the Senior Associate at SRCD and the Consortium Coordinator. We're excited to welcome you to today's webinar, Family Engagement and Partnerships in Rural Communities, Challenges and Benefits in Early Intervention. Before I turn things over to our speaker, I want to say a few words about the consortium and about using GoToWebinar. The University-Based Child and Family Policy Consortium is a network of more than 25 university-based institutions, including centers, schools, departments, and programs that have an interest in child and family policy. We are organized around three main purposes. First, to share the latest findings and strategies for conducting policy-relevant research and to facilitate collaboration across our member institutions. Second, to encourage cross-disciplinary undergraduate and graduate training to support the next generation of child and family policy researchers. And third, to foster effective translation between research, practice, and policy audiences. The consortium is run in collaboration with the Society for Research in Child Development and hosts a number of webinars each year on a variety of topics. If you are interested in learning more about the consortium, having your institution join the consortium, or if you would like to join our listserv, please see the information on this slide. Just a quick word before we begin about the technology we are using today. We are using GoToWebinar to host this webinar. All of the attendees are muted. If you have questions for the speakers, please use the question box on your screen to submit the questions. Today's webinar is being recorded. After the call ends, I will be uploading it to SRCD's YouTube channel and will share that link with all of you. If you have colleagues or friends who were not able to make today's call but are interested in the content, please share the link with them. And now I'd like to turn things over to Dr. Susan Sheridan, who will be our speaker today.
Thank you very much, Patricia. It is my real honor to participate in the webinar today and talk about something that's very near and dear to my heart and an area that is really critical in the area of early childhood education and development, and that is family engagement, and in particular family engagement and partnerships within rural contexts. We've been doing research in this area for many, many years, living in a state like Nebraska, which is where I'm located, at the university here in Lincoln. We are fortunate to have the opportunity to really explore a mix of geographic locales and realities and begin to understand how they influence early learning and development. Nebraska certainly is a very rural state, and so many of our partners and colleagues are working and functioning in rural settings, but we also have a couple urban contexts here in the state with the Omaha and the Lincoln urban areas. So we're really having the opportunity to juxtapose how things look across these different geographic locales and begin to understand the various nuances, both strengths and challenges that each geographic context presents when it comes to early learning and development. I would be remiss if I didn't start by acknowledging some of my really fabulous colleagues who've been contributing to this research that we've been doing for many, many years. Lisa Knoke is a close colleague, and she and I co-lead many research studies and we have for many, many years. And I'll share some information about some of our joint studies in a little bit. Carolyn Pope Edwards is another person who has worked very closely in conceptualizing, developing, and executing some of our intervention studies over the years. Chris Marvin from Special Education and Communication Disorders is somebody who's helped us in significant ways when it comes to really thinking about and understanding family-centered services and family engagement. And Helen Rakes, of course, is somebody who's really helped us significantly within the context of rural and urban Nebraska and how we're positioned then and have a place to be informed by and inform the rest of the country in this very important space. We have a set of methodologists and data analysts who have helped us not only to think about how to design studies and execute studies, but collaboratively co-develop important methods that we're able to utilize within our longitudinal and other types of studies. Research assistants and key personnel like Randy Clark, Keely Klein, Courtney Boyes, Amanda Moen, and Sandra Scruggs have been very, very important in the day-to-day operations, as well as thinking forward into the next set of studies that we're embarking upon. And funding is obviously a very important part of our ability to do the nature of work that we do at the scope that we do it. And the research that I'll be talking about today actually is some research that was funded by the Interagency School Readiness Consortium years ago. That was a consortium of agency partners at the federal level who came together and identified a real priority in terms of understanding how to help our most vulnerable children and families, in our case, be prepared for school. This is NICHD, ACF, ASBE, and OSERS came together and launched this very important collaborative consortium. But IES is currently funding some of our research in this area, as is the Agency for Children and Families. And so I'll be talking about the things that we're learning collectively across these different studies. So I'll start then by talking a little bit about rural and rurality and the context of rural. In many parts of the country, rural communities and the children and families who live in them are poor. Although sociodemographic risks like poverty are salient for all children when they are a reality in their lives, the intersection with rurality is particularly potent. A few facts about rural contexts. Over 85% of persistently poor counties in the United States are rural. And more than half of poor children in the United States actually live in non-urban settings. Rural families lag significantly behind non-rural families in income and parental education. You'll see that in some of the samples that I'll be talking about today here in the state of Nebraska and the families that we work with. Rural economies within rural communities tend to depend on low-wage jobs, very labor-intensive jobs, many in the service sectors. And this affects socioeconomic status, but it also affects family structure and family and school resources and the ability for families and schools or families and agencies to connect, which is going to be a big theme of what I'm talking about today. Furthermore, by definition, rural communities are isolated, and this results in limited access to resources of virtually every kind. Rural providers tend to have fewer credentials and resources. They tend to have less specialized training, lower salaries, and fewer opportunities for professional development. Things like having greater geographic distance to centers and agencies, dispersion in social networks, limited educational, health, mental health, and recreational opportunities. All these things create access barriers for our rural families. And some of our research has shown, ours and others has shown, that rural children actually have different levels of exposure to effective parenting practices and home-based educational resources. We'll talk more about this soon as well, but as a result, when compared to children growing up in urban areas, rural children often enter kindergarten with fewer skills in the critical areas and domains such as literacy, math, and social emotional development. Now, there's of course a lot of strengths in rural communities as well, and I'm a firm believer that rural America is, actually a very special place for children to be raised and educated. In fact, rural communities have what we're calling a certain psyche or sort of personality or identity that's really important to appreciate. And you see this much more in rural communities than you might see in heavily populated urban areas. On the one hand, rural communities do tend to value collaboration and cooperation. I mean, the schools and agencies that we go into often have this sort of, we can do it attitude, and people will do whatever it takes to support children. They, professionals in rural communities tend to adopt very flexible roles then in supporting not only children and families, but community goals at large. And there is a very high priority on families and relationships within rural communities. There's a very strong sense of community and pride within that community. Rural communities have closely connected social networks that enable information and attitudes, this would include both positive and negative attitudes and information, to spread very quickly. And they're often very stable networks with deep family ties that remain over generations. And this really defines their place within a community. This deep-rooted sense of allegiance and pride and community and place may actually, unfortunately, sometimes lead to distrust of professionals or public helping agencies. A fear of being judged by others, for example, could actually inhibit some families from engaging in meaningful ways, especially in tight-knit rural communities where there's very little privacy and everybody knows everybody else and what's happening within families. So there's often sometimes a stigma about receiving help and support. This community culture, this rural culture that emphasizes self-reliance can also discourage individuals from participating in programs that are aimed at alleviating concerns or supporting families when they're posed as problems to be addressed. Perceptions about help giving or family assistance for something as personal as parenting, and when you think about it, parenting is really probably the most personal thing there is, and all of these communication channels that are sometimes very powerful and uncontrolled, all of this might transmit inaccurate information and add to distrust for families. So that's an aspect of the psyche of rural that is just a reality that we have to think about and attend to when we're engaging in help-giving roles within communities that are characterized as rural. So why families? I just mentioned the fact that there can be challenges when really focusing on families in supportive help-giving kinds of contexts. Why is this so important? Why partnerships with families? I'm probably preaching to the choir a little bit here, so forgive me for that, but it is in fact clear that family influences, family practices, relationships within the family and between families and providers or help givers have a significant effect on children's development. It's widely accepted that parenting attitudes, behaviors, and their provision of resources for the child to support his or her learning and development is strongly related to academic and social behavioral adjustment. And rural schools and families then are uniquely positioned to benefit from family partnerships, largely because of all the strengths of rurality that I just described. Their focus on community and the strong networks that are inherent within rural communities. Relationships and the orientation that folks living in rural areas and towns often have. All of those strengths really can be leveraged by focusing on families. And all the challenges that we see too in rural communities, like limited availability of resources, limited access to and logistical barriers for gaining support. All of these things prime rural settings as ideal places to develop and utilize partnerships as the context for supporting children's development. And it's really unequivocal. There's been decades and decades of research now that show that when educators, early childhood educators and others, work closely with parents as partners, children demonstrate gains in cognitive, academic, behavioral, and social-emotional domains. The benefits of high-quality family partnership intervention programs are evident for even the youngest, most vulnerable children. I will say a little bit about theory in just a minute, and I think it's important to couch what I'm talking about within an ecological frame. This ecological framework does provide the context or the foundation for most research on partnership interventions with families. However, much of our work in the field has tended to focus on the microsystem as the place, that notion of strengthening the home and strengthening the classroom as places to support children's learning, as as the focus of our research. And less attention has been given to the importance of relationships and community in rural areas. So our focus, and I'll get to this in just a minute, so don't advance the slide quite yet, our focus in our research is, yes, on strengthening the microsystem as a place and a space to support children's experiences and their opportunities, but we also spend a lot of time focusing on the mesosystem and exosystem, and I'll talk about that in just a minute. According to ecological theory, the sources influencing child development and learning, as we all probably know, are viewed as occurring within and across multiple levels and multiple systems. And all of these are embedded in and interact with influences at varying levels. So the experiences, the influences that are most proximal or closest to the child are the ones at this microsystem level. It includes things that the families provide. These are the immediate things a child will experience in his or her own very proximal immediate environment. Experiences with the families, things families and parents provide, their practices, the interactions a child will have with his or her parent, et cetera, and also the kinds of experiences and exposures that occur within classroom or other immediate settings like neighborhoods, like play areas, like playgrounds, things like that, daycare centers, et cetera. And children are, in fact, part of many microsystems, as this graphic portrays. And the important aspect, though, when we think about all of the strength of the ecology surrounding children, comes to play when we think about interactions and intersections between these microsystems. The next level is, in fact, the mesosystem, and it's defined as the connections or interactions and relationships between these immediate and proximal environments. Examples here include things like home-school connections, parent-teacher relationships, and continuities, or in some cases, unfortunately, discontinuities or disconnects between settings, in particular home and school settings. The exosystem is a little bit further removed from the child, but it has a significant impact nevertheless. This includes influences at the community level. In fact, the effect of rurality, in our case, is something that would be an exosystemic influence on child learning and development. It includes services the community will provide to support children and families at risk, or things that are happening within the community in positive or negative, supportive or toxic kinds of ways that can really impact their development. It also includes the attitudes or the psyche, again, of the rural setting as well. Finally, the macro system encompasses the cultural and ideological realities within which the broader context of the early learning environment fits. So the point that I'm going to make today is that we really need to look at the entire ecology surrounding a child. Too often we stop at the child and microsystem levels, that immediate experience of how to support, quality classroom experiences, or how to really support a home environment or help develop a home environment as a nurturing environment. All of those are critical. All of those things and areas of research are really essential to bolstering the experiences of young children. However, my argument is that we can't stop there. We really also have to look at the mesosystem and the exosystem as well. Relationships between those microsystems, relationships between the adults and the settings and the systems that support children, and also those broader community level exosystemic influences to understand issues of reality and how they intersect and interact to impact a child's opportunities and outcomes. So, given all this, it seemed important to us in an earlier study to determine how rurality does affect the role of parenting. Again, we're looking now at multiple levels here, exosystem, mesosystem, and microsystem, how it affects the role of parenting on child learning and behaviors. And we undertook a study that investigated the relationship between rural parenting practices and child outcomes. We used the ECHOSB database, so it's a large nationally representative sample, and we examined whether preschool parenting practices and children's social behavioral skills in kindergarten were related to rurality. So we were looking at the kinds of parenting practices and the kinds of experiences that the child was receiving while in preschool and how that related to their social emotional functioning in kindergarten, how all that was related to the rural context. So we wanted to know first, does living in a rural community influence children's social behavioral skills when they're in kindergarten? Secondly, we wanted to know, does living in a rural community influence parents' affective behaviors during preschool? And third, do parents' affective behaviors during preschool mediate the relationship between geographic setting and social behavioral skills when the child is in kindergarten? What did we find? A study was published in Early Education and Development in 2014. We found first that rural children actually experienced greater difficulties with externalizing behaviors than their urban and suburban counterparts. Now, this is parent-reported externalizing behaviors. We weren't the only ones to find this. Others have found this result as well. Secondly, we found that rural parents tended to display less emotional support than parents in other settings. And finally, that preschool parenting behaviors were associated with social skills and behavior problems in kindergarten, as reported by both parents and teachers. And this was really important. And for rural parents, emotional supportiveness was found to account for the relationship between the rural setting, or I'm sorry, geographic setting in general, and children's social skills, such that rural parents who provided less emotional support had children with lower social skills in kindergarten. Now, considering that interactions with parents may represent the most frequent and the most prevalent social exchanges available to rural children, given the small community size, given the sparse population base in most rural areas, the importance of parental emotional support in rural children's developing social skills becomes very, very evident. The parent is the one person that they're spending the most time with, and there's less exposure to many other kinds of social interactions. So interventions that are designed to promote parent support of children's behaviors and skills really seem particularly useful for rural families. So we became very interested then in exploring family partnership interventions in rural settings that capitalize on, again, the psyche of rurality. We had the notion that it was going to be really important to build trust and minimize stigma, to leverage the resources that are in rural communities, especially family, communal, relationally based resources, and to build capacity within settings that by definition, again, are isolated, dispersed, and under-resourced. Partnership interventions do all of these things. Partnerships between families and schools are couched in relationships. They're developed and refined through intentional interactions over time, and they place a priority on the relationship between homes and the other kinds of settings that children are learning, growing, and developing within. The focus then is on relationships between these systems rather than distinct or separate or parallel roles. The elements of trust, mutual respect, two-way communication and joint planning and problem solving, all these things that are important in rural settings, are foundational when it comes to establishing effective family partnerships. So the goal of family partnerships is to leverage human capital on behalf of young children, which again is seeming to be really important in resource-strapped environments. Parents, by definition, can support the human capital for our efforts around educating children. So we are specifically interested in improving learning experiences and outcomes for children by strengthening relationships within and between systems, within and between homes and schools, and by addressing shared concerns that they had, the shared goals and the shared concerns that educators and parents have for their children, and by increasing cooperation and collaboration between parents and early childhood educators. So the Getting Ready intervention, the Getting Ready approach is an approach or an intervention that we've been researching for a number of years now. The Getting Ready approach, I guess I go back and forth, and forgive me for this, but I'm going to probably go back and forth a little bit calling it an intervention and an approach, partly because we're still trying to land on the best way to talk about it. It is an intervention. Our research, as we'll be talking about a little bit later, has been tested through randomized controlled trials. We are now in the third RCT, and we're finding not only very exciting results, but very consistent results across our studies. So, it's starting to really show some of the foundational elements of an evidence-based intervention. But it's really more than that. It is an approach. It's a way of doing business. It's a how more than a what, if that makes sense. It is an exemplar for us, when it comes to talking about partnerships. And it's focused on child and family and school readiness. It promotes children's learning and development by strengthening relationships, building competencies, and promoting collaboration among families and schools, among families and early childhood educators who really do share the responsibility for the learning and development, optimal learning and development of young children. It's very flexible. It's very responsive. That's why I like talking about it as an approach, as a way of doing business. But it is couched in a process that has some discrete and observable elements, these strategies that can be used across different contexts. It's really all about engaging and interacting with families across different contexts and utilizing these relationship-based partnership-building strategies in virtually all opportunities and interactions with families. It's really not a curricular program. We're not asking our early childhood educators and providers to pick up a curriculum and do something with a family or with a child. Rather, it is a set of strategies that are really all aimed at strengthening relationships and building competencies in order to co-create the opportunities to bolster children's learning. There's a graphic on the next slide that illustrates how we are thinking about it as an approach that really is encompassed and defined within this set of strategies that are focused on both building relationships and building competencies among parents and providers, but that can be used in both structured contexts and unstructured contexts, in contexts that really have a focus like home visits and parent-teacher conferences, and that are more informal interactions. That doesn't mean it's not intentional. In fact, it's very intentional across all contexts, but it's a natural, informal way of interacting with families to build their competence and their confidence in supporting their children's development. So I'm going to break it apart a little bit now and talk about the strategies, and then we'll move on from there and discuss the contexts. First, we'll talk about the relationship building strategies that are at the core of the intervention. the approach. There I go. Sorry about that. The first is to communicate openly and clearly. So when interacting with parents or family members, know that when we use the word parent, we're really describing the adult who is responsible, primarily responsible for the well-being of children. May or may not be a biological parent. So that term is used to represent an array of individuals who might be responsible for the child. The early childhood educator will communicate openly and clearly. Two-way communication is really a key aspect of this intervention, and parents' input is always elicited via questions, open-ended questions, opportunities to check in and understand the parent's perspective, not necessarily to always quote-unquote do what the parent feels they want to do first and foremost, but as a partner, learn to understand and respect each other's perspective and how both are important and contribute to how we help the child move forward. The parent-child interaction is really at the core of this intervention. When interacting with parents, it's always about the parent-child. I think that's really important to remember. Whether we're talking about parenting strategies or skills or supporting the affective side of the parent-child relationship, whenever we're talking with families, it's really, even in terms of supporting some of the other basic needs a family might have, it's always best, I think, to bring it back to how it affects the child and the parent-child relationship. So when interacting with parents, we talk about elements in the environment that can be actively and intentionally arranged or rearranged to encourage positive, mutually enjoyable parent-child interactions that provides the opportunity and context for some supportive, nurturing interactions to occur. We affirm parents' competencies. We provide a lot of affirmation and validation of what a parent is doing and obviously doing. Even if we don't observe it, we can observe it by how the child is growing and developing and gaining new skills. We like to really make sure we give the parent a pat on the back as much as we can and validate the fact that they are doing a really important, they're playing a very important role and really supporting their child in ways that are unparalleled by others. We learned a lot from Tweety Yates, if you know Tweety and her work, and Jeanette McCollum, that developed an intervention years ago, and we borrowed language that they've used in their intervention, and when we talk about building competence and confidence in parents, and this is one way that we do it, through affirmations and validations. And we also, another aspect of building strengthening the relationship between families and educators is through the mutuality in decision-making that can occur when we have conversations as co-equal partners. When we talk about goals for children, when we agree upon them, when we develop priorities based on what's important for the family and what's important for us as educators. So it's truly a partnership. Competency building strategies are another set of strategies. They all occur sort of in a natural context of interacting with parents, again. And here we're doing things that are a little more intentional around moving toward helping build their capacity as parents that are going to help develop and grow skills in the child. So we focus their attention on specific strengths of their child and needs to move along a developmental sort of trajectory. We help by sharing information and resources that are again two-way, that both provide some basic information about things we might be observing their child doing around developmental domains, but also, explaining some resources that could be available and helpful to the family to support the child's development. We are very committed to using observations and data to guide decision-making and doing that in a very collaborative way. Parents' observations of how the child is performing in different settings, things that we're observing in the center or child care agency or early childhood classroom, using those data to continuously move forward around goal setting, decision making, and monitoring. And modeling and suggesting is probably the most direct strategy when it comes to building competencies and helping parents build competencies. These are statements or behaviors about interacting with the child that really help achieve goals. So sometimes we just need to model for a parent a strategy to use with the child or to practice with the child, or that might be useful with their child when it comes to some basic skills and goals that are being set. And ask the parents to practice that as well, and maybe suggest even through some explicit intentional statements how the parent might interact with their child during an interaction when you're observing or when you're not, when they might be interacting in various other settings. Quickly, I'll talk about the contexts now within which all of these strategies can occur. The unstructured, informal interactions that we have during drop-off and pickup times. We can have conversations with parents and use things like affirmations and validations and touch base about how the goals are coming along and things that we're observing in the classroom and that the families are observing in the home setting. All these kinds of brief, intentional exchanges are really important because we're creating important connections all the time and bolstering parents' confidence and competence all the time. Even the way that we structure our written communications, our newsletters, our emails, our text messages, our voicemails, everything, all the interactions that we have with families, if we can think about building the strengthening relationships and building competencies through those strategies incrementally, it really is an important message to send to the family. In structured situations like home visits and conferences, we put all this together in a collaborative planning process. Certainly the opportunities we have for a more structured sit-down one-on-one with a family is a great opportunity to share observations, set goals, determine how we can help the child achieve the goals and get to the next steps. We co-develop a homeschool plan that can help the child as he or she moves forward along the goals that are set, and continuously modify and monitor progress toward those goals as we continuously meet and informally and formally then around the child's progress. And I think you can probably easily see how the strategies to strengthen relationships and build competencies would really fit very nicely and easily into a very supportive, strength-based collaborative process. So I'll talk about one study now that was done in a rural early Head Start setting. And this study was this particular study will talk about the effects on parenting strategies as a function of the Getting Ready intervention. We've been doing, as I mentioned, randomized controlled trials for more than 10 years now, and I think I'll focus on this particular study because it really illustrates beautifully, I think, the strength of the approach in really focusing on important strategies with parents at a very young age. As I mentioned, this was an early Head Start population. Home visitation was the model used here in the state of Nebraska, and the focus was on very poor rural families. We assessed parental warmth and sensitivity, support for autonomy, and engagement in learning interactions. Those were the three, that was how we were defining parent engagement in terms of warmth and sensitivity, support for the child's emerging autonomy, and parents' participation in learning. So a little bit about the context of the study. There were 3 early Head Start programs in Nebraska that were participating with us. All were very rural, highly agricultural and industrial. So there's sort of a mix in these rural communities. There were some meatpacking plants, and so there was a mix between agriculture and industry as the economic base. and, as I mentioned already, home-based services. So the families were receiving Early Head Start in the home for about 60 to 90 minutes each week. Just a quick word about the characteristics of our early childhood educators in this study. 1/3 of them had a high school diploma as their highest degree. So we were really interested in helping to build capacity of the early childhood educators in interacting with families in ways that were supporting their engagement. There's a heavy coaching and professional development component to our intervention. I'm not going to talk about that today. Yeah, fewer than 20% of our providers had a 4-year college degree. As far as our children and parents, we had more than half of our families were unemployed. Close to half of them had less than a high school degree. The average age of the child at time 1 at the entry into the study was 10 months. And they were involved in the study for their entirety throughout Early Head Start. So we had at least 24 months with them, or at least 2 years with them in the intervention. Again, it's not really an intervention, it's an approach. So it's the way the Early Head Start providers were delivering their services was through this very intentional parent engagement, relationship-based approach. Okay, I'll be quick in talking about how we were measuring the parenting behaviors, because this is going to be the focus of the talk today. We used a scale by Dale Farron called the Parent Caregiver Involvement Scale. All of the 11 behaviors that we were coding in terms of the parent-child interaction were coded in terms of quality, appropriateness, and amount. So there were 11 behaviors we coded on these 3 dimensions, and then we did our own factor analysis and found that there were various combinations of items coded in ways that loaded onto 6 factors. In the middle column, you'll see the 6 factors. Quality of the warmth and sensitivity, quality in terms of their support for learning, and quality in terms of how parents encouraged autonomy comprised the first 3 factors. They were all quality dimensions. Support the appropriateness with which they supported their child's learning and the appropriateness with which they provided guidance and directives were another set of factors. And the final 6th factor was an amount factor, and that was how they provided constructive behaviors around teaching and responsiveness. So quality, appropriateness, and amount, and they kind of loaded onto our dimensions of parent engagement, warmth and sensitivity, support for learning, and encouraging autonomy in various ways. Experimental design included a random assignment of providers to treatment and control conditions. We used multi-level modeling, and it was a 3-level complex design so that observations, the repeated observations over time were nested within each child, and children were nested within the provider. The assessments were conducted every 3 to 5 months throughout their experience in Early Head Start. Okay, so what did we find? We found a number of significant time by group interactions across many of the factors on our observation measure. I'm going to do a little bit of a spoiler alert right now. The majority were in the areas of quality and appropriateness, and that's important, I think, and we'll come back and talk about that in a minute. First, though, you'll notice that in all the graphs that I'm going to show, you will see a striking difference in the growth curves and the outcomes between treatment and control conditions. So not only do we notice that they start at a pretty similar place at time 1. Again, the average age at time 1 was 10 months, when the child was 10 months. We see the parents interacting with their babies in a way that's similar across our 2 groups. And over time, again, every 3 to 5 months, as we tracked them and monitored the parent-child interactions, we see different patterns in our treatment group, which is in red, and our control group, which is in blue, so that by the end, there's a pretty significant gap between the parenting behaviors with our relationship-based getting ready intervention group and our control group, typical Early Head Start services in the rural communities. All of the effects I'm going to show you are significant at 0.05 or better, and all the effect sizes you'll notice are really highly meaningful. So first one is quality of parental warmth and sensitivity. Parents in the Getting Ready treatment group interacted with their children using a greater degree of high quality warmth and sensitivity than the control group. Next, you'll see the quality of parental encouragement of autonomy. Again, very different patterns here compared to parents in the control condition. Parents involved in Getting Ready demonstrated high quality skills to support their children's autonomy. They were sensitive to the types of goals they set. They used quality approaches to support their children's activities. Next, you'll see some of the appropriateness factors. So the appropriateness of the parental support for learning, the third dimension of engagement. Remember, we had warmth and sensitivity, support for autonomy, and support for learning were the three dimensions of parent engagement in our model. The appropriateness with which parents supported children's learning, highly significant, effect size of 1.02, and notice again the upward trend for a treatment group in doing things like providing fitting support for their children, appropriate teaching behaviors, appropriate verbal interactions, and actually downward trends along the slopes for many of our control group outcomes. And again, that gap at the end before they exit for Head Start seems to widen. And finally, the other significant effect that we found was the appropriateness of guidance and directives. So parents in the treatment group were observed to provide more appropriate guidance and directives, again, well matched to the child's developmental level and interest in terms of how they were structuring things for their child. By and large, what we're thinking here is that by the time rural children exit early Head Start, in almost all cases, the parenting gap widens. The gap between Getting Ready children and control families and warmth and sensitivity, autonomy support of the child, supporting the child's learning and providing appropriate guidance and directives, the gap between parents widens over time. As I mentioned, the effect sizes are very large, meaning the findings are very real. And I should mention that, again, the other factor in our observational schema was an amount variable, the amount of constructive parenting. That we didn't find significant effects on the amount variable, only on the quality and appropriateness variable. So we think it's really interesting that parents may be parenting about the same amounts, if you will. They're doing about the same amount of things, but the quality and appropriateness with which they're interacting with their children around learning and around that warmth, connectedness, relationship with their child is where we see such striking differences over time. The last data point is at the end of early Head Start as they're just now getting ready to exit and go into whatever kind of preschool program they might be entering. So partnership interventions, namely in this case the Getting Ready approach, really seems to be essential for rural families who are disadvantaged. I'm watching the time and I'm going to sum up now so that there is some time for questions, but in sum, relationship strengthening strategies that are used by early childhood educators may effectively address challenges that are unique to rural settings, things like small communities and the attitudes of participants that are often based on generational histories within that community. We really believe that the increased trust and the positive attitudes that are really part and parcel to partnership interventions occur as a result of the intervention. Given that there is frequent contact, there's very constructive problem solving that occurs. Collaborative problem solving that occurs. It's a strength-based approach where we're starting with where the families are at and where the child is at and really leveraging those strengths to either incrementally or significantly continue to make progress, help the family and child make the progress that they determine to be important for themselves. There's mutual input, I talked before a little bit about the importance of responsibilities. That's not to say that separate roles, I should say individually defined roles is a better way of putting it, are not important, because they are, but it's roles within the relationship that are defined that seem to make a difference. So rather than thinking about what's done at the home and what's done at school and sort of these parallel spaces, roles are co-defined within the context of the relationship. And the communication obviously is critical when it comes to relationship-based interventions and approaches. Finally, those competency building strategies meant to really build capacity of families and educators, in fact, really seem to address the challenges that are unique to rural. Things like the fact that there are limited availability of specialized services and few resources. Again, we're building human capital now. The long-term role constructs and parental self-efficacy, things like parenting engagement and partnerships, seem to really be an important aspect of the intervention that hopefully, and this is a very important next research question, will sustain over time. You know, what happens to that parenting gap, and do we see these parenting behaviors sustained? Are we helping parents create a construct for themselves, a role for themselves that will move forward as the child advances through school and schooling? We certainly hope so. But again, I think there's lots and lots of things that we're speculating about the importance of this intervention, how it works and why it works, and it's going to be really important that we continue to pursue it in rural America, because we think it creates such a nice opportunity and a great fit. That summarizes some of the work that we've been doing here at the University of Nebraska, and I am very eager to hear what folks are thinking and kinds of questions people have.
Thank you so much, Sue. I'd like to quickly turn it over to Dr. Ihemoa Iruka, who's going to moderate our Q&A for us today. I know many of you submitted questions in advance or through the question box, so we'd like to answer as many of those as possible in the next 5 to 10 minutes. So I'd like to turn it over to Ihemoa.
Great, thank you. And thank you, Sue, for such a wonderful and comprehensive webinar presentation. And so I hope everybody can hear me okay. I apologize for my rough voice. I have a little bit of a cold. But let's jump right into the questions, Sue. So the first question that is coming through is, do you ever encounter resistance implementation of interventions, especially in rural communities? And if so, how do you really promote buy-in, especially around your Getting Ready project or other projects in the rural communities?
That's a great question. The question about resistance and buy-in. I'm going to actually reframe that a little bit if I can, Ihemoa, because I think resistance is a little bit of a tricky word, and in some cases it can be a little bit dangerous, only because it suggests that we have an intervention and we want people to do it, and if they don't, they're resistant to it. And again, that's a message that we try to avoid. Of course, I'm not going to be overly simplistic here, because it's a question that is a real question, and it's something that does, in fact, challenge some of our efforts in all communities, including rural. The fact that there's often, or perhaps at times, a mismatch, a disconnect between how we want to be supporting families in their efforts to support children and what they're actually picking up, taking up, and implementing with their young child. So we approach those kinds of situations in a manner that's very consistent with how we approach the entire intervention, and that is from a relationship-based, partnership-based perspective. We start by, ground zero, basically, or the zero step, as one of my colleagues used to call it. Before we do anything, we really focus on understanding the family's perspectives, where they're coming from, what their goals are for their own child. Every parent has some goals for their child. Every parent wants what's best for their child. They don't always know how to communicate that, and they don't always know how to achieve that or deliver that. So we start by focusing on the relationship first and foremost. The whole partnership orientation suggests that when we focus on the shared goals and then learning about the family, from the family, and with the family, we're going to be in a much better place to determine what elements of our intervention actually fit within their unique family culture and context, and then how we can work to support that element first. And when we get that, then we can build from there. Sometimes we take baby steps in terms of setting the expectations for engagement and the goals that we have as far as outcomes. Heck, sometimes, you know, even the smallest little signs of uptake, they're answering the door. That's a good sign for some families. Or, you know, the things that, it's all relative how we define what a success story is for each family. But I think we really do need to think about it first and foremost as a relationship that we're entering into with a family, not a service we're trying to provide to a family.
Thanks for that. And so another question that's coming in is really regarding the issue of who are the participants? Are they mothers or fathers? And if it's more mothers, what any sort of thoughts about fathers and potential implications or specific tools or strategies that you may be using with fathers if you do have a large sample of fathers in your studies?
Yeah, that's a great question too. Thank you for that question. In our study, in this study that I described today, and in the studies that we are, we're finishing an RCT right now, and then we're going to, and we're sort of in the midst of launching a third. Most of the identified participants are mothers. But I will say, again, for example, in this sample that I talked about today is a home visitation model, it's a home-based early Head Start program. There were fathers home some of the time when we went into the home, and we absolutely worked to connect and engage with fathers as well. Again, it's about co-creating the meaningful role that each participant will play. So we can't assume that we will know what or how a mother or father, but in this case, let's say a father, is most comfortable or equipped to engage or participate. So once we can establish a dialogue and start that conversation, we ask questions. We don't assume, we don't tell, we don't dictate or prescribe, we ask. And we've had more families tell us, gosh, you know, nobody's really asked us that before, or nobody asked what I thought or what my opinion was or what I thought would work best here in my own home. So, so we can't be afraid to do that. We don't approach it as going in and having all the answers. We have a set of assumptions, and we have of things that work and how our intervention's working and things that we think are really critical as far as the evidence base of the intervention is concerned. But the manner in which we roll it out has to be individualized and responsive to the individuals, whether they be fathers or grandparents or other kin who are part of that system that's supporting the child's development. We start by trying to understand from their perspective what and how it will all work.
I'm wondering whether we should take another question since we only have about a minute left, Sue, but maybe just if you can briefly just maybe for like 10, 15 seconds, can you just address the question of what role does technology advancements play in engaging rural communities? So again, maybe 30 seconds at the most.
I'll be really brief because it's an exciting question and one that we're really doing a lot with here in Nebraska, both in our own center and other centers around the College of Education and Human Sciences. People are really exploiting technology in such a positive way through health and mental health service provision, and now even we are using long-distance coaching and looking at the effects of that across the state of Nebraska to engage in many of the same ways, providing coaching and direct support to our providers, our classroom and early childhood educators. So it's wide open, and I think through texting, through video-based means, through Bluetooth, there's lots and lots of ways to connect, and it's becoming much more acceptable you know, and the ability to collect data even at a distance through webcams, GoPro cameras and things like that is, and applications and smart technologies is a very exciting next step for all of us. I think we should embrace it.
So I want to thank everybody for joining us, and I want to say for those who we didn't get to their questions, please follow up with either Rachel or Patricia or even Sue if those questions are really burning. But I want to thank Dr. Sue Sheridan, Director of the Nebraska Center for Research on Children, Youth, and Families in Schools at the University of Nebraska-Lincoln. And so I'm going to turn it over back to Rachel and Patricia. Anything else before you close up?
Yeah, just a few quick wrap-up notes. Thank you again to everyone who joined us today, especially thank you so much to our speakers. If you enjoyed today's call, you might be interested in other consortium webinars. The next one will be on February 15th, and the topic will be universal home visiting. Also, just to kind of reiterate what Ihemoa just said, I know a lot of people had questions that might not have been answered on this webinar today. I would encourage you to check out this website here on this slide and look for some of the other work that Dr. Sheridan and her colleagues have done on children and youth in rural communities, as well as you can follow up with me, Patricia Barton at SRCD, with those questions. And then finally, just a little bit of consortium news. As many of you have seen, we launched a new consortium website earlier this week where you can join the listserv and see a lot of other resources, things going on with the consortium. So if you're not already on the listserv, please join it to receive notifications about future webinars, our quarterly newsletter, as well as job and event announcements. You can follow this URL to our new website to join our listserv. And I will be sending a follow-up email to everyone who registered for this webinar, and I will attach a copy of today's slides as well as the recording of this webinar, which will be posted on YouTube. I know that was a question that some people had, so you will be getting a copy of these slides. And then just thank you again to everyone for joining us, and I hope everyone has a great rest of their day.